Okay, so first we'll just go through the benefit guide. If everybody can grab it, we'll just do a quick tour just to help you understand it a little bit. And love the artwork. Again, thank you, Kelly. It turned out really nice. That's obviously our historic courthouse on the front. And it mentions the plan year on the front cover. Okay, and then inside the introduction and welcome, there's some good general information about benefits and how they work. And then on page 3, some important information about your responsibility with your benefits. And then on the right-hand side of page 3, some really good information. There's a consolidated list of all the contacts for your benefits. That's a really good resource right there. Okay, and then on page 4 and 5, we get into the medical benefits. And if you notice in the middle of page 5, where the red exclamation point is, that's our default plan for everybody, the Blue Care 56C. That's your plan, unless you select another one. And that's the richest plan. And then page 6 and 7, they go into some of the plans, co-pays, out-of-pocket, some of the higher level expenses that you typically encounter. It's not every single detail of the plan, but a lot of good information there for your reference. And then page 8, that talks about the health savings account. It's a very unique arrangement. Be very careful. You need to understand it clearly. It's called a high deductible plan. And if you take that plan, you've got to kind of plan your budget accordingly. Okay, so be careful. And it affects other benefits that you can utilize due to the laws related to that type of a plan. And then page 9 is the Wellness Center information, and Jarvis is going to speak to that. Just important to make sure you know you got to be on our health plan to use the wellness centers, okay? And then page 10 and 11 goes into our dental benefits. We have 2 dental providers. Page 10 and 11 is Florida Blue. And then 12 and 13 is Humana. And then if you go to page 14, that's our vision benefits. And another great feature, and David's here with Always Care. He's got some information. They have an app because, you know, everybody has an app now. So Always Care has an app as well. Page 15 is our EAP program, and Tricia Mahoney's going to speak to that today. It's a great benefit, and it's confidential. Nobody ever knows who used it, if you used it, why you used it, anything like that. So it's always good to remember and know it's a great resource. Page 16 and 17 talk about our life and disability benefits. And then on the second half of page 17 just has a little bit of information about our retirement benefits. Okay. And then 18 and 19 is some information on how to calculate your rates for the supplemental life and disability products. And then page 20 and 21 are the AFLAC products. Steve's here back in the back. And then starting on page 22, if you ever have insomnia, just take this home. Start reading on page 22. I guarantee you won't make it to the end of the guide. These are all the mandatory disclosures. All right, so that's just a quick nickel tour of the benefit guide. Want to remind everybody that when you log into PEP, where you check your pay statement, there's the benefits and deductions tab up at the top of the page. If you click on that, that's where you can see what benefits you currently have selected. That way you know what you have in case you want to change or you're not sure what you picked. Look in there in PEP, and then you can see what deductions are coming out of your check for what type of benefits. Okay, and of course, if you have a question, ask us and we can help you interpret it. Very happy to announce that we were able to lower the family premiums. Obviously, employee-only coverage is paid by the county, but we've lowered a lot of the family plans. Those are not typos in your guide. Those are the premiums, and we're very grateful for that. The wellness centers, Jarvis is going to talk about them, but just know, unless you're on the health savings account, we've only got about 23 people on that plan, so most of you are on some other one of our plans, though. You can typically walk into the wellness center with no out-of-pocket. You get seen, and then they've got about 30 medications in the formulary. That's the list of medications that they dispense. No out-of-pocket expense to you, okay? And all this information is on our webpage, on Inside Pasco, on the benefits page. And again, the Employee Assistance Program is a tremendous resource, and we've got Tricia here today to talk about that. And our Reliance products, that's our life and disability. We've also added a critical illness and an accident product as well, and Debbie will be happy to explain that to you also. And then Benefits Plus, they're new to us this year, and Kim is going to give you a presentation on that in a little bit. Okay, so I mentioned with Reliance, another great announcement, our basic employee life that's employer paid that you don't have to select at all currently is $5,000. In January, that's going to go up to $25,000 for everybody. You don't have to do anything. So that's another great enhancement we've been able to do this year. And the voluntary life product, that's something you can take additionally if you choose it. GI is guaranteed issue. That means they don't ask for an evidence of insurability medical questionnaire, all that. They'll insure you up to $100,000 guaranteed issue. That's upon your initial eligibility, which is at new hire. If you've taken any of those products and it's less than $100,000, they're allowing a one-time increase of $10,000. It's in $10,000 increments, so you could make a one-time increase. If you're interested in doing that, just see Debbie. She can explain it to you. And then we added the accident coverage and the critical illness coverage. Okay, the universal enrollment form, we rolled that out last year, tried to consolidate 7 forms into one to try to make life easier. We're using that form again this year. If you're not making any changes, you don't have to do anything at all. If you're only changing one thing, saying switching a dental plan or adding a dependent or dropping someone, just need to fill out that section. You don't have to do the entire form, just do the section that applies, like vision or dental or medical. Make sure you list your dependents or others on the plan on the back of the form. Make sure you sign it. Make sure you select post-tax or pre-tax on the form. And if you have any questions, just let us know. We'll walk you through it. But only need to do the section that applies to the change that you're making. Otherwise, everything you have will remain exactly the same. And there's also beneficiary information on the front of the form. If you haven't updated your beneficiaries or you had a change, marriage or divorce, something like that, I would encourage you to update your beneficiary information. And remember, Florida Retirement System has a beneficiary form also. We have those forms. They have a separate form that they require. So make sure your beneficiary information is up to date for FRS also. Okay, very important. We want to make sure the right people get the benefits in the unforeseen situation that something does happen. Okay. Again, with the voluntary products as well, no form needed if you're not making any changes. All right, a few things to keep in mind. And again, this PowerPoint is up on our webpage and the benefits page as well. Okay, but always, if you're getting some sort of procedure done, please go get a pre-authorization. Work with your doctor or your dentist's office. They understand the procedures and the codes and your plan. That way you don't have any surprises. You go in and get something done. They say, oh, you need a root canal, have a seat. Okay, you're done. You go home and you get a bill for $700 in the mail. You don't need those surprises. So make sure that you coordinate that ahead of time, okay? And if at all possible, avoid the emergency room. You can go to our wellness center. You can go to an urgent care center. Your out-of-pocket is going to be lower, and it costs the plan less. That's the reason we're able to help reduce premiums, is because we're self-insured. If we keep the plan healthy, you guys actually end up reaping the benefits, okay? And the dental plan, there's a couple that have what's called a 12-month exclusion. If you already have creditable coverage with one of our carriers, you'd be fine. But if you're picking up dental for the first time, there's a couple of the plans that have an exclusion for major work, like root canals and crowns, things of that nature. Because that's a big, expensive procedure. They don't want somebody coming in with no prior coverage because it's kind of a higher risk to them. So talk to the dental providers. They're here. Florida Blue, he can speak to the dental Tony, or Jackie for Humana. Some of the plans do not have the exclusions though, so just ask that question if you're selecting dental for the first time. And make sure your EOB, that's your explanation of benefits you get in the mail. Make sure you read those carefully and hang on to it. If you ever have questions about your bill, you can pull that out, and then when you call customer service for Florida Blue or Humana, whatever the situation is, they're going to ask you questions that are going to be listed on that EOB, so hang on to that, okay? And again, all the information is available on Inside Pasco on the benefits page. And there's our phone number if you need us, of course, or send us an email, and we'll do whatever we can to help. All right, and that's it for me. Don't look so sad. Got some other great presentations. They're just going to pass it off to each other. Any questions before we go forward? All right, I'll introduce Trish. Yes, ma'am.
Just want to double check. The health benefits start October 1st, but that new life insurance where you're upping it from 5 to 25, that starts in January.
That kicks in January. The typical plan year is 1 October, same as a fiscal year. The way the contracts were set up a while back, there were some logistics issues with the timing of the contract, so our rate increase and some things are kicking in January. But we did change the contract, so everything's gonna line up in a couple of fiscal years. September of 2017, everything will be lined up. But that's just the one minor change is, yes, in January for the 25,000, and if you have a rate increase on your voluntary products. And we'll be getting that word out to you. But for now, everything in the benefit guide, those numbers are good to use for calculations. Okay, thank you. All righty, Tricia, it's all yours.
Good morning. My name is Tricia Mahoney, and I'm the account manager for your group. I actually am in North Carolina, but I am from Florida. I was born in Bradenton, raised here for about 10 years, then I moved all around. I have been with CompSci for about a year and a half. Before that, I was in local government for 13 years in human resources, and I'm going to tell you a little bit about your program. If you have any questions, please feel free to just raise your hand. CompSci is the world's largest employee assistance program. We have been around for 30 years. We just celebrated our 30th anniversary. And we're owned by Dr. Richard Chaffetz, and he has been with us since day one, and he has stayed with us. He's very involved in the day-to-day business activities. We are also the leader of critical incidents worldwide. If there's ever a problem at work, an employee passes away, or there's an accident, we can be on site to help you. All right, it's kind of hard to see it. Our Guidance Resources Program is your we offer confidential consultation on personal issues. We have online resources with Guidance Resources Online. We can help you with legal information and financial information as well. At the heart of our program, it's short-term counseling. We offer you and your immediate family members up to 6 visits with a counselor, a local provider, and this is per person, per issue, per year. So let's say you're having problems at work with your coworker or your boss. You can give us a call, talk to a counselor, and we can come out, we can assist you. I'm getting a little nervous up here. I need the EAP now. So you can go see the local provider, talk to them, up to 6 visits per issue. Let's say a few months later you're having problems with your adult children. Feel free to give us a call back. It's a different issue. And this is also available for you and your immediate family members. They do not have to be on your medical insurance. And as Kevin mentioned, it is completely confidential and it's voluntary. So if you're interested in calling us and getting some assistance, we'll help you out. I'm the account manager. I get all of the information for the account. I never receive employees' names, date of birth, any kind of information like that. Guidance Resources Online is our website. It is an excellent resource. If you haven't been out there yet, I highly recommend you go out there. You can do assessments, you can look at calculators on financial, legal, wellness. I mean, it's just a wealth of information. Help sheets out there to help you as well. We are smartphone and tablet optimized, so if you have a smartphone, you can download our app. Like you said, everybody has an app. We have Guidance Resources Now as ours. Legal information. You can call 24 hours a day and set up a phone conversation with one of our in-house attorneys. And this is for anything, from family law, wills, bankruptcy. Recently we had a client who had a speeding ticket, called our lawyers to see if he needed representation. He was going 15 miles above what he thought was the posted speed limit. He thought the speed limit was 75. We do not have a 75-mile speed limit in North Carolina. So this client, I'm not going to say it's my child, but let's just say this client, he was actually going 90 in a 45. He was going double the speed limit. He's lucky he didn't get his license revoked immediately. So when he called our attorneys, and he immediately got told, yes, you need representation, son. So if you ever need representation, if you call and you ask for some advice from our attorneys and they say you need representation, we'll set you up with a local attorney. You'll get 25% off of their fees. That really helped him because he had to go to court 3 times, and the last time he wasn't available to go, so the attorney went for him. He does still have his license, and he drives a little bit slower now. Financial information. Again, this is a telephonic benefit. You can call unlimited times to talk to our CPAs and financial experts. A lot of my clients use this around tax time. If you want to save some money and not have someone else do your taxes, let's say you just don't know what line 37 means, give us a call. Don't guess. You don't want to guess on taxes. Give us a call, talk to one of our CPAs, and they'll help you out with that. They can also help you with estate planning, saving for college, retirement planning, and getting out of debt. And you can also go on Guidance Resources online and get a lot of these resources as well if you'd rather do that yourself. Oh, see, I told you I'd whip right through it. Do you have any questions about the confidential counseling that's available to you and your family members? One thing I do want to mention too with the family members, we take a very relaxed attitude towards that. If somebody calls this 800 number and says they're a dependent or they're with you in this group, we go ahead and help them out. So let's say you're living with your boyfriend. He's under your roof. We're going to help him out. So it's not somebody, we're not going to go through it and say, okay, how are you related? And really kind of drill the person. That's not what we're here to do. We're here to help you. Everyone has work-life issues that they're dealing with. I could give a lot of examples of the different times that I've called and talked to our different departments about things. I've got 2 kids getting ready to head off to college this year, so obviously there's a little financial planning that was involved in that. And then my oldest son, I try not to tell too many stories about him, but I did have to throw that one in there. So we're really here for work-life balance. Counseling is the main thing we do. However, feel free to give us a call if you need help with something that's legal or financial, or go online to Guidance Resources online. Check out the resources. There's a ton of information out there. Like I said, the assessments are really nice. We have on-demand videos that you can, like if you don't have time for a 45-minute seminar, you can go on to Guidance Resources online and look at the 5 to 7 minute version of it. And it's interactive, like one of them, my favorite one, is emotional eating. Are you an emotional eater? You can just, in your office, just check that one out. It is interactive. It asks a question. They say it as a way to kind of, I think, mess you up a little bit. They said, the question on that one is, does ice cream make you feel good? Anyone? I said no because I thought it was a trick question, but I think the answer is yes. So go out there, check it out. If you haven't done it yet, please do. And if you already have been out there, please go back. Every month we put new content out there. We have editors in-house. We're constantly adding content to the website. So any questions about your employee assistance program? No? Okay. Well, thank you so much.
Thank you. All right, Jarvis Fogel with HealthStat.
Thank you. Good morning, everyone. I'm Jarvis Fogel. I'm your account manager for the wellness centers. I hope you've all had a chance to use them, and if not, I hope to give you some more information today, and maybe you will go check them out. I'll be as brief as possible, but if I don't answer any questions, feel free to step over to the HealthStat table, and I'll be able to answer your questions more in depth. So just to start off with the agenda for today, the scope of services I'll be reviewing, clinic staff, clinic hours and locations, your scheduling, the options you can go about to do that in our technology platforms, and then the health risk assessment. So our objective, I'm not going to read these bullet by bullet. The overall theme of this is really the last bullet, though, to build a culture of health and wellness. We really want to help you on your journey, on this journey, and that's why the wellness centers are here. We wanted to make sure you had access to providers and to the medications that you may need to help you along your journey of obtaining your health and wellness. So our scope of services, a lot of times people think about the wellness centers, they think about going if they get up and feeling icky and maybe they have a sinus infection or something like that, and that's fine. We absolutely want you to utilize the services for things like that. The biggest benefit of having this here, though, is when you wake up and feel icky, you can still come into work and go to the wellness centers without utilizing your sick time. You can go and utilize the service on the clock. I think they give you an hour to use it. If you do need medications, it's a one-stop shop. Kevin mentioned earlier that there are about 30 medications on the formulary. And so if you go in, if we have it, the doctors can write you a prescription and give it to you right then, and you can start taking it immediately. If it's something that we don't have, we can still write you a prescription and you can go to your pharmacy of choice. In addition to the acute and episodic care, we do chronic disease management. So if you do have any of those chronic diseases, you now have that accountability partner here at the county. There's also care coordination that goes on. So we wanted you to feel, and we wanted you to understand that we're not trying to replace your PCP if you have one. Our physicians will work in conjunction with. So we're not going to take you off of any medication or put you on anything without consulting your other doctor if you're going to that provider. And then there's also workers' comp, and then wellness and prevention. So the staff, there's Dr. McGregor. Dr. McGregor, she serves the Newport Richey location. Rose Hollendak, she does both. She does the Dade City and the Newport Richey. And then Christine Matos and Wanda Rubenstein are our medical office assistants. The hours. So the Dade City location is open Tuesdays and Thursdays from 7 a.m. to 6 p.m. The Newport Richey location is open 6 days a week, Monday through Friday, 7 a.m. to 6 p.m., and Saturday, 7 a.m. to 12 noon. The scheduling line, we have an 800 number for your convenience. That's so we didn't want you to run into any issues if you had to call the location directly and the doctor is in with somebody and the medical office assistant is seeing someone. We wanted to make sure there was a person that answered your call. And so the 800 number goes directly to the HealthStat corporate office. So you'll get a live person to answer and you'll be able to schedule your appointment appropriately. So this is what I like to call our kudos and complaints line. We want to know, HealthStat really wants to know what we're doing well and if there are any opportunities that we can improve upon. So you do have, of course, your human resources department to call if there's a problem that should arise, but we like to hear it straight from the horse's mouth. So if something comes up and, if our providers did a really great job, we want to know about that. We like to give accolades where they're due. But if something happened and we need to address the problem, we want that opportunity to change it and to make your experience as best as possible. The patient portal, I know everyone has been saying there's an app for that, and there's an app for the patient portal. Since everyone these days we're carrying around many computers in our pockets, of course, there's an app for it. The patient portal is very valuable. It allows you to schedule appointments, view your lab results, request medication refills, and then to communicate back and forth with your doctor, so with the doctor there at the wellness center. The patient portal is very helpful if you're in with your doctor and, say you had labs done in the wellness center and you forgot your lab results to take them back to your PCP to review. Well, you can pop out your phone and log right in, and all of your history that you've done at the wellness center will be right there for you and your physician, so you can have that more meaningful conversation. This is just a display of how the patient portal looks inside. It looks a lot for me. I'm in North Carolina, in Charlotte, and so I have Duke Energy, but it looks a lot like other energy bills or a water company bill with the dashboard being on the left side. So it's very user-friendly, nothing to trip you up. Other hospitals use this. This comes directly from our medical record system, so other hospitals are using the same type of electronic record system. Our health risk assessment. So last year in December, we came on site and you had that opportunity to do a health risk assessment. What that looks like is you would go into the clinic and they would you would fill out a health questionnaire. We call it the HAWK. And they would do a draw from you to measure your glucose levels, HDL, LDL, and they did some biometrics on you. And so you would have received a letter from HealthStat 3 to 4 weeks after the conclusion of that event. That letter would have shown you it would have given you a risk factor, so a number. And year after year, we're going to be back on site in early 2016 to do the next wave of, we call them HRA, so health risk assessments. And if you go, it really is a baseline so you can see year after year what you're improving on and where you're getting worse. So I like to think of this as an alarm for you. So everyone has heard the emergency weather system, correct? That alarm that goes off to let you know weather's making up in your area. Well, since we don't have an alarm walking around with us, it would be nice to let you know a heart attack is coming or a stroke is coming, but we don't have that. This is a great way, a great opportunity for you to see year after year where you're getting worse, where you're getting better, and things that you may need to draw some attention to. And that's all I have for you right now. Are you gonna come up?
Yeah, I'll come right up. I have one more thing.
Oh, sure.
Okay, thank you, Jarvis.
Sure, thanks.
Sorry, I lied. I'm back. One thing real quick I wanted to mention when she showed you the hours for the wellness centers, the Port Richey and the Dade City location, we're only doing Tuesday and Thursday in Dade City, but we monitor every month reports on utilization, and there's still slots available. So until we see the demand, then we could, though, increase the hours and potentially look at a Central Pasco, Land O'Lakes, Wesley Chapel location in the future. But we're watching utilization, but we are aware of that, and we'll continue to monitor it and make adjustments if we need to.
Are the wellness centers available to retirees?
Yes, as long as you have our benefits, they are available to dependents and retirees as long as they're on our plan. Yes, thank you. Great question. So now I'll turn it over to Tony Coe with Florida Blue.
You're good with that last name. Good morning, folks. I'm going to try to make this as painless as possible because it's a lot of information that you should know or are pretty familiar with. So we'll go from there. Like Kevin said, my name is Tony Coe, and I'm an educator for Florida Blue. I'm not the salesperson, so don't shoot me. Look to Monica, who's the salesperson. Okay. What we're going to go through here is just important terminology. We're going to get into the benefit summaries a little bit. I'm not going to bore you. You all can read. So I'm just going to point out specific things that you all need to look at before you pick your plan. The similarities between the plans and ways to save. All right, these are all just definitions. So the deductible, co-pays, co-insurance. I do want to point out out-of-pocket maximum here, which is the maximum a mayor pays out of pocket in a benefit year. And that includes your co-pays to your doctors, your prescription, what you've paid for prescription co-pays, and your deductible. All rolled in, that adds up to make your max out of pocket. And you can monitor this by registering online with us, and you can see where you are with your deductible and where you are with your max out of pocket. Once you get to your max out of pocket, we cover everything at 100% for the remainder of the benefit year. So you'll never have to pay another copay to your physicians, another copay to pharmacy, okay? The provider, it's the person, hospital, et cetera, clinica that's providing services in network. This is very important because on your HMO plans, you don't have any benefit if you go out of network. And on the PPO plans, your best benefit is staying in network because that's going to give you the best payment or cost for what you're doing. You're going to pay a lot more going out of network on the PPO plan because we have no control of what the doctor charges you. Okay. This is the balanced billing here is important for that going out of network on the PPO. To give you an example, if we have negotiated with the primary care doctor that the visit is going to be $150 and your copay is $50, we're going to pay the $100, right? Now, if you're on the high deductible plan and you have to pay toward that toward that deductible and pay those visits, you're only going to pay $150. But if you go to out-of-network doctor, if that doctor charges $500 for that visit, we have no control over that, and you're going to have to pay that $500. And if your benefit plan is that we're going to pay 50%, we're going to pay 50% of what we would normally pay the doctor. So if as my example was that the charge was $150, your copay was $50, you still paid that, and then we're going to pay $50. You're still going to be responsible for everything above that $50. So if they charge $500, you're responsible, and that's where balance billing comes into play. So very important to stay in network. And I'm going to show you how to stay in network. Simple ways.
I know you're talking about in-network and everything. How does it work if, how you're out of state vacation? How do y'all coordinate that if you end up at the hospital or a doctor's office?
Okay.
You can come back or whatever, but
I'm going to come back to that a little bit, but I do want to mention it. So HMO. So let's just talk, well, let's see. We're on HMO, so good leeway, okay? So you've got several different HMO plans, only covered in network except for emergencies. So you've got an emergency service, you can just go to any hospital, okay? We're going to cover that. You're out of state, emergency, you're only covered for emergency services by way of the emergency room. So you're in Georgia, you break your leg, you go to the emergency room. You're there in the emergency room and the doc says, we've got to do surgery on that leg to put in a pin. Now you're going to be inpatient by way of that emergency room. Okay, we're going to cover that.
what about a PPO?
Okay, now the PPO plan works seamlessly. So you can actually go on an HMO plan, you go to Georgia and you see Aunt Susie, and Aunt Susie says, you need to see my dermatologist for that bump. You can't go to that dermatologist, even though they're on Blue Cross and Blue Shield of Georgia. Okay? On the PPO plan, you can. You can go, that's where the blue card comes into play, and the PPO has a little suitcase on the card. You see a little suitcase on it. And that one you can, as long as that provider is on that specific network of Blue Cross, Blue Options, Blue Choice, etc., except for Blue Care, you can access, and it works seamlessly. You pay your typical copay, and that's it. And that's one of the beauties of the PPO plan, that you have that option to go wherever you want. Okay, so let's take a look here and what things you need to look at in choosing a plan. What I want to point out is at the top here, above the numbers, you see the network. The network is Blue Care. That's an HMO. The care designates that it is HMO. So anytime you see that, you know it's HMO. What does that tell you? I've got to stay in network. So we shoot across. They're all Blue Care, then Blue Options and Blue Options. Those last two are PPOs. So what are we looking here? We're looking at, and what you need to keep in mind for each one of you, what you and your family uses. Do you normally just have office visits? Do you go to urgent cares a lot? Do you worry about the deductible? So this is the things that you need to look at. So right here, on all of them, you can see what you have to pay to go to your family physician. Now on the HMOs, if you already are on the HMO, you know you have to pick a primary care doctor. You can change that doctor at any time, but I'm also going to give you a little tip that you can go to another primary care that's in the network without switching. Okay? So, let's say you call your primary care and they can't get you in for 2-3 weeks and you're sick. You can actually access another one. You go to the website, you find another one that will see you today. You can go there with the same copay. All right? And then let's say you like that doc and call us back and switch to that primary. Okay? Because we want you to, you can keep accessing someone else, but remember that doc is controlling your care and authorizing things, so we want to make sure that you're going to the right one that we've got where the information is going, okay? Keep in mind always on the HMOs, you don't need a referral to go to a specialist, an in-network specialist. Now, I'm going to give you a little caveat. The specialist offices are used to getting a referral from all the other plans. So you come in and you're like, oh, this guy's in network, I'm going to go there. You come in, hi, I'm here for my appointment, and they say, the girl's up front, where's your referral? You say, no, Blue Cross doesn't require referral. And they're not used to that, so they're like, no, that's not the case. We've got to call Blue Cross. We're going to cancel your appointment. We've got to reschedule, etc. So what we recommend is that when you see your primary, that you never have to see, actually, to access a specialist, but we recommend you do. You say to the primary, listen, I go to a cardiologist every 2 months. I see my gastro. I see this specialist. So that they just write on a script, cardiologist, gastroenterologist, whatever. Keep that with you. When you show up at your specialist's office, pull that out. Where's your referral? Here you go. Oh, all right, fine. And it's seamless to you. And I'm telling you that just so that you don't hit a bump in the road. That you've gotten off work, you're going to the doctor, and then they're like, wait a minute, you need a referral. And you're like, well, the insurance guy said I don't need a referral. No. That's not true. Every plan needs a referral. You're on an HMO. Okay, so take that, keep it in the back of your head like, just in case. Okay? Yeah.
That's not always true, though. You can't, this is from Blue Cross, because I went round and round with them. I can't go see my dietitian unless I have a referral from my doctor.
The dietitian doesn't count as a specialist. Okay? So think of the specialist has to be an MD or DO. Okay, so that's a little different on the side. Okay? And the referral, well, then there's big ticket items, like if you're going for an MRI, the doctor has to approve that and give you an authorization. Okay, big ticket items. Think anything $500 and up. What's it going to cost? So think that. So I'm saying to go to that specialist. Okay? So there's always little things that pull off to the side, right? There's always something. So we can't address everything because we'd be here all day with everyone's individual issues. All right? Okay, so your specialist here, you see on this one, on the first one is 35, the next one's 65. The next one, the Blue Care 122, is deductible. So you've got to pay. Remember I gave that example of the $150? So if it's $150, you're going to pay the $150, our negotiated rate. You're going to pay our negotiated rate. And be sure to ask, when they give you the price, make sure you ask, is that the Blue Cross negotiated rate? You have the full right to ask that, because they may be saying, this is our office visit rate, it's $300. No. What's the Blue Cross negotiated rate? And folks, they all have computers in their offices, and they have a system called Availity, and they check everything on Availity that's direct to us. They check your eligibility, and they check what that code is, what the doctor has negotiated for that specific code. Okay, for that office visit code, whatever. So I see a lady back there nodding. She knows a lot of this. So you're just going to go across the board. I want to point out your annual physical of things that are absolutely at no cost to you, meaning no copay will be paid. Annual physical. Ladies, your GYN visit, if you're presenting without a problem, your annual. Mammography, for those 40 and over, not presenting with a problem. And colonoscopy, 50 and over, not presenting with a problem. Now let me tell you how to go about getting this at no cost. You're going to make the appointment with your in-network doctor. Let's talk about a physical, your annual physical. In-network doctor, and you're going to tell them, I need an appointment for my annual physical. When you arrive at the office, you're there for an annual physical. And the girl at the front desk may want to charge you your copay or part of your deductible, etc. But you know what? You've downloaded our app that everybody has, right? And you can show them not only your insurance card, like the Geico Pig that shows the little insurance card, but that it's at zero cost for your annual physical. When the nurse calls you back, what are you here for? I'm here for my annual physical. If you start telling the nurse all your woes, it's going to fall out of the annual physical, be diagnosed at something, and they're going to charge you your copay or part of your deductible as you walk out the door. Now, you can do that as many times as you want. I'm just telling you how to do it so that you do not get charged. But doctor comes in. What are you here for? I'm here for my annual physical. Okay. But you were here, this is the doctor that you have a relationship with, and you're here 3 months ago for this problem. At that time, you have to stop the doctor. and say, doctor, I'm only here for my annual physical. We'll talk about this our next visit. Again, you're more than welcome to talk to them about the issue you're having them and use your annual physical some other time. Okay, and all of these, there's no limit on how many times you can access your primary, so make use of it, whatever works for you. I'm just telling you how to do it without getting charged that copay. The doc is going to give you a script for blood work. Who is our in-network lab? Quest, very good. Quest, think Quest is best. Quest is the only in-network lab in the state of Florida. Period, end. Doesn't matter what the girls at the office tell you or the doctor tells you. But, oh, this is a buddy of mine, they'll accept your insurance. Oh, they will accept your insurance, and they're going to accept all the payments you make to them after the fact. Okay? And to give you an example, blood work for an annual physical, it usually, the average is $1,200 to $1,500 if you go out of network. If you go to Quest, it's $0. Okay, so that's pretty easy, right? You know, 1,500 or 0, I'm going for the 0. All right, so all of those, the rest, mammography, ladies annual, colonoscopy, same thing. Right, you're not having any issue. Did you have a question? Okay. All right, your pharmacy on these. Before I touch on pharmacies, where can we get free antibiotics with a prescription? Publix, very good. Stop by the Publix pharmacy, get the card with the names of those medications on there. There's several antibiotics and metformin for diabetics and 2 high blood pressure medications for free. Just when the doctor says I've got to prescribe an antibiotic, take out your little card and say, can you give me one of these? They're free. Where can we get $4 generics? Walmart, Target, Winn-Dixie, and I forget which other, but the ones with the largest list of $4 generics are Target and Walmart, as well as Target and Walmart always work with you if the medication, the actual retail price is $6, $8, they won't charge you your whole copay. They'll just charge you what the drug is. So on each one of your plans, except for the ones that are high deductible, you've got $10 prescription coverage for generics. Okay, but I'd rather pay $4 than $10. Okay, so keep all or get them for free. The next slash and the price that's there is preferred medication, name brand but preferred on our list. So on this first plan it's $25, the next one's it's $30. You're always going to pay towards your deductible on these, et cetera. And the next one down there is $60. And the last one, that PPO, only has coverage for generic medications. So it's got to be $10. So keep that in mind if you take a lot of name brand medications, et cetera. But folks, I highly recommend you talk to your physicians, have the conversation with them about putting you on generic drugs or switching you to generic medications. Now on our website, which when I get to it, there's a section that actually shows you what's the generic equivalent to the medication, the name brand medication that you're on. Okay, and I want to give you an example. Nexium. We all know about the little purple pill, right? It's one of the most prescribed medications in the United States. Now that drug costs the plan, you all, $450. Okay, if they prescribe Nexium, right? So y'all are paying that out, but you're going to go up and you're going to pay the highest fee, which is $40, $50, $450, $100, and the other one it won't be covered. But the generic is $10. That's a big difference. The plan is actually going to be charged $20, and you're going to be charged $10. So it's the same pill. It's even purple. So make use of it. Talk to them about the generic.